So what will happen? There are a lot of tumor cells. These tumor cells are very unstable. They are metabolically very, very active. They are breaking down. And so what happens? Of course, that it puts a toll on the kidneys. So the patients can go for acute kidney injury. There's going to be arrhythmias because of these electrolyte abnormalities. There is hyperkalemia, there is hypocalcemia. So there can be cardiac arrhythmias. Because of these metabolic abnormalities, of course, it can result in seizures and finally death. So this tumor lysis syndrome can affect patients of all ages. It is not specific for pediatric. It can affect all ages. Typical timing of TLS is the initial few days after the start of chemotherapy, or you just diagnose it and the patient has a very high tumor burden. Even few days before the onset of chemotherapy, TLS is very, very at high risk. And this can be observed not just after chemotherapy. So initially, as you can recall, the first it was initially itself it was discovered, or it was coined and identified after patients who underwent radiotherapy. So this is quite common in patients who are undergoing radiotherapy, who have been given only steroids, who have been given immunotherapy, or it can even occur as spontaneous TLS in certain tumors which has a very high tumor burden. Acute leukemia, more than 1 lakh. Burkitt's lymphoma especially is very, very high risk for TLS. Okay. So you should understand what are its consequences and what is the timing. And it's not only because of the onset of chemotherapy, but even after, it can occur spontaneously. It can occur after radiotherapy, immunotherapy, after just steroids also. So this biochemical syndrome, as we just discussed already, that 4 metabolic abnormalities you should be aware of. So the risk span will be 3 days before and 7 days after the initiation of therapy. So I told you those 4 metabolic abnormalities. Why these 4 metabolic abnormalities occur, we will see. First is hyperkalemia and hyperphosphatemia. Basically, potassium and phosphate are intracellular contents. So the tumor cells are breaking down and then it is releasing this potassium and phosphate. So that causes hyperkalemia and hyperphosphatemia. These tumor cells are breaking down, the DNA is breaking down, it releases the nucleic acids are metabolized by xanthine oxidase to form what? Uric acid. So there is hyperuricemia. And phosphate combines with calcium. So it is a hypocalcemia is a secondary metabolic abnormality. So once phosphate and calcium combine together, it results in hypocalcemia. And once the injury is happening because of the tumors are getting lysed, the cells are breaking down, cytokines are released into the circulation. Okay, so these metabolic derangements plus the inflammatory effect, the cytokines are getting released, it puts a burden on the kidney, so resulting in acute kidney injury. Okay, so this is what I just mentioned. So potassium, phosphate are all getting released from the from the cells because of the cell breakdown. The nucleic acids are breaking down into the adenosine and guanosine, that is purines, and then these are metabolized by xanthine oxidase, acted upon by this enzyme called as xanthine oxidase to form xanthine and hypoxanthine. Xanthine will be further enzymatically acted upon by xanthine oxidase. Xanthine oxidase is one enzyme, it acts in 2 steps. So xanthine oxidase converts hypoxanthine to xanthine and xanthine to uric acid. So xanthine is then converted into uric acid, so that results in hyperuricemia. This enzyme, which you can see here, that is rasburicase, will convert uric acid into allantoin. Allantoin is a water-soluble byproduct. So we need to convert the excess uric acid to allantoin and then make it to be excreted. Okay, so this is about the uric acid pathway. Phosphate, potassium are all intracellular contents that are coming out because of the cell lysis. And because of the cytokines that are getting released, that will put a pressure, or that will take a toll on the body's immune system. So that can even result in hypotension. Okay. So this is just a small flow chart that you can recall for your tumor lysis pathology.